What change is ITLS making at this point in time relative to spinal management?
Well, prior editions of the ITLS textbook have widely supported the notion that injured patients should be placed on a spinal board until cleared by a physician. However, recent clinical studies now demonstrate that that may be detrimental to patients.
So what is the long spine board recommended for?
The long spine board is a transfer device to transfer a patient to a cot.
Okay. And in what circumstances at a scene would we be using it?
For instance, to extricate an individual from a car onto the long spine board to an ambulance cot, and then the spine board should be removed.
Okay. How will the course be adapted?
We will make adaptations to our Spinal Motion Restriction chapter, and we'll be also integrating sections on how to remove folks from a spinal board.
What's important about making this change now?
All the research has indicated that this is not only the right thing to do, but by leaving patients on a spine board can be detrimental to them. It can impair their respiratory efforts, it could cause pressure sores, and it needs to be integrated at this time.
How could this improve patient outcome?
Patients will be more comfortable. We are more likely to keep their spine in alignment without a spine board than with a spine board.
What's the key takeaway message for us?
Spinal motion restriction should be applied to patients who have a high likelihood of having a spinal injury. However, the use of a long spine board is not appropriate or required to achieve spinal motion restriction.
It is the position of ITLS that the use of the long spine board and other rigid devices are designed to move a patient to a transport stretcher. Pre-hospital providers must maintain competency in the use of these devices. Prolonged time on a long spine board and/or prolonged time on scene applying these devices can be detrimental or result in poor patient outcome. In order to minimize these negative occurrences, patients should be removed from the long spine board as soon as it is safe and practical to do so. Pre-hospital providers should use due diligence to minimize spinal motion among at-risk patients. The ITLS Editorial Board is developing tools to assist the instructors with facilitating the change in spinal motion restriction.